Hi, I'm Captain Anthony Zimmer, 2008 FEYA Award winner, and I'm pleased to introduce Vice Admiral Regina M, our U.S. Surgeon General. She just gave us a wonderful presentation at the FEYA Awards luncheon, and I have a few questions for her. So welcome, ma'am. The first question that I had was intriguing to hear about your prevention strategy, because as an engineer, it makes perfectly good sense to prevent a problem before it actually manifests itself into a problem. So I was wondering if you could just give us a few additional words or comments about prevention and public health.
Well, health doesn't occur in the doctor's office and the hospitals alone. It occurs every place, in everything that we do, where we live, where we learn, where we work, where we play, where we pray. And so prevention is in everything. And fortunately, during the Affordable Care Act established a National Prevention Council, and that council is made up of 17 cabinet-level members to focus on prevention. And our goal is to increase the number of Americans who are healthy at every stage of life. And we released the National Prevention Strategy, and that strategy is to reach that goal and to do things other than just not other than just, but in addition to good quality health care, we need clean water, we need safe highways, we need affordable food, things that we can be around us every day, clean air. And those are the things that engineers have been doing all along, and that's helping us reach that goal, making sure that our water systems are safe, that our homes are safe, that we have seat belts, things that keep us safe and prevent us from having illness and disease.
Okay. That speaks very well to us as engineers. In regards to just sort of a follow-up, right now society is undergoing sort of an energy crisis, and energy costs are going up. I had the opportunity years back to work on sick building syndrome, and if we were looking at indoor environmental quality, and specifically your intention to really prevent smoking. I was hoping that maybe you could speak just a little bit towards environmental quality, indoor environmental quality, and secondhand smoke.
Well, all smoking is bad, and so my
yes,
goal is to say don't smoke, and if we can make a smoke-free society, that's our ultimate goal. One of the things that people tend not to realize is that our smoking efforts have been successful, but we have young people who are continuing to start to smoke, and we're starting to rise. Every day in this country, 1,200 people die from cigarette smoking, and each one of those deaths are being replaced by 2 young smokers. We call them replacement smokers. And 90% of all smokers start before the age of 18, 99% before the age of 26. So if we can just get that young group to not take their first cigarette before the age of 18, that generation could become tobacco free. And so we've been working to figure out ways to do that, to have them to understand how important it is. Where we've got smoke-free buildings or smoke-free environments, but what we don't tend to appreciate that particularly multi-level homes, multi-apartments, the apartment with multi-units. The smoke goes through the walls, and we can measure that smoke goes through. We have public housing, for example, where we've asked people, we're not forcing people to adopt these things. We asked them, would you like to have a smoke-free home and a smoke-free building? We have waiting lists for people who want smoke-free buildings, because that secondhand smoke has been proven to be just as dangerous as primary smoking. And so we are working with engineers and housing and urban development. Many of the housing authorities are now having long waiting lists for people who know and ask to have a smoke-free, not just a smoke-free apartment, but a smoke-free entire multi-unit.
Excellent. So I have a final question here, and this is regards to an agenda that's pushed out throughout the United States, STEM, sciences, technology, engineering, and mathematics. And I guess my question is, as the Surgeon General, how would you promote STEM?
We have to set the examples, be the examples, and encourage young people to go into STEM careers. And particularly minorities, and particularly women and girls, those numbers are low. In medicine, for example, while 25% of the population is minority, less than 9% of the physicians are minority. That's the same percentage as during the Flexner Report of 1912. We haven't increased those minorities, those numbers, those percentages. We have to encourage them, set the example, do whatever we can to have them on the pathway, to be interested in STEM careers. Engineers, the numbers or percentages are just as low, so, or maybe even lower. So we need to make sure that young kids going from elementary to middle school, that they start being interested in science and technology and engineering and medicine. Those are really important. And we can do that just by setting the example, encouraging them, talking to them.
Well, it's funny. And on a personal note, I actually have a 9-year-old daughter whose current desire is to be an engineer. So I'm hoping that the encouragement, you know, that we get from society, and, well, from mom and dad, you know, help her to pursue a good career. So
one of the things I tell young people is that you don't have to do one thing. They're in a culture and at a time where they multitask. So they can be an engineer and a doctor. They can be a lawyer and a doctor. They can be a bioengineer and develop the next great medical device and save millions of lives, make lives easier. So they don't have to do just one. They can do a number of things.
Well, Dr. Benjamin, very much appreciate you coming and talking to us.
The other thing I'd mention is safe and healthy homes.
Okay.
And we, just a few weeks ago with Housing and Urban Development with the EPA, released a Safe Homes and Healthy Homes initiative, which built on our previous Surgeon General's Healthy Home call to action. We want to make sure that people understand that your home is where you spend most of your time, and there are things that you can do to make it safer. You can make sure that the hot water heater is turned down below 120 degrees so you can prevent scalding, that the stairwells are basically, your staircases are stair-proof from children so that children and older people don't trip and fall. The rugs are not in a place where they'll trip an elderly person. That on the second and third floors, that the windows are locked where toddlers are so they don't fall out. Simple things that can make the home safe. And we need engineers to help us design some of those things, but we can have safe and healthy homes.
Thank you, ma'am. I very much appreciate you coming here today to talk to us.
Thank you, and congratulations on 100 years of engineers in the United States Public Service. The first engineer was hired in 1913.
Yes, ma'am. Yes, ma'am. Thank you for acknowledging that.
Thank you.
Okay.
Thank you.
Thank you, ma'am.